Dr. Kirby Thompson, owner and operator of Wildflower Wellness, licensed naturopathic doctor and acupuncturist. And today we're here for Dr. Kirby's Pick August 2019. Now, for Dr. Kirby's Pick August 2019, I was thinking about things that I've seen a lot in the clinic. And what came to me was the carpal tunnel syndrome. Carpal tunnel syndrome, as we all know, is a narrowing of the carpal tunnel, causing numbness or pain in the wrist and hand, specifically the first 3 digits. We do see this a lot. I've seen severe cases and also mild cases. So, what causes that narrowing of the tunnel or thickening of the structures? There's actually a lot of things that can cause that. Repetitive use syndrome, repetitive use of this, like, mail carrying, right? Jackhammers, factory work. I even had one lady that had problems after a lot of video game playing. And she's actually a friend of mine. This was quite a few years ago. And she just quit playing video games. So why did that happen? Sure, it's repetitive use, but there's always an underlying issue. What I find is that most of these people actually do have some digestive issues, whether it be liver, gallbladder, or small intestine, stomach, things like that, as it presents in a Chinese medicine fashion. Now, also a fashion of gas bloating, problems with stools, things of that nature. Or in Chinese medicine, what's called a liver blood deficiency as part of that. Now, what does that mean to you? Well, let's talk about risk factors in the textbook. And then we'll talk about ways to address that. Now, we will be doing a talk on carpal tunnel next year. So if you'd like to know more information, of course you can always schedule an appointment, or you can come to our talk. I'm very available for our clients and patients. Anyway, so number 1 is obesity. Now, most of the time when it comes to obesity, we're talking about standard American diet. Diet matters. Diet can cause the next risk factor, which is diabetes. Remember, if you have diabetes or obesity, your hormones are really not functioning correctly. Insulin is a hormone. It can mess up all the other hormones, which brings us to number 3, hypothyroidism, right? If you have hypothyroidism, what's the function of thyroid? One of the thyroid hormones actually goes into the DNA to, the nucleolus of the cell to tell the cell what to do. It can help you make enzymes in order to digest your food. It actually has a very big function. So the thyroid is also a very big issue. Blood sugar, obesity, thyroid. Now there are some other things too. What also goes along with that hormonal vein is menopause, perimenopause, or just general hormone problems, PCOS, endometriosis, not managing those well. Remember, it was said by Dr. Dick Tom, ND, DDS, if you have a problem in one hormone, you got a problem in them all. And I do find that to be quite true. So, other things, non-hormonally based, which actually can be diet-based, right? Whether you have an exacerbation of these conditions or not, and I must read because there are a lot of them. And pregnancy. Don't let me forget about pregnancy. That's also a hormonal issue. And you have you see a lot of people have problems with carpal tunnel in pregnancy. You don't anywhere else. And that's the only time they have that problem until they reach perimenopause. So, other risk factors are trauma, burn injuries. Think about that. If you burn, you swell, you have all that water. It constricts the tunnel and the structures. Swell. Ganglion cysts, right? You're obstructing that tunnel. Scleroderma, leukemia, tumors, Paget's disease, other pyogenic factors, sarcoidosis, infections, and hyperparathyroidism. So actually, carpal tunnel syndrome is it's basically you know, could be a symptom of something else, but it is manifesting in what the Chinese call the channel, right? Manifesting in the channel. So how can you help this? Well, there are some preventative measures. Number one is diet. Diet and exercise. If you look in the naturopathic textbook for any condition, it says diet and exercise. It tells you what to eat. It's wonderful. Other physical modalities, one of my favorites, we're just going to do a few, is the hydrotherapy. Hydrotherapy, including Epsom salt baths, hot and cold, both showers and baths. You know, 3 minutes hot, 30 seconds cold. I love hydrotherapy and castor oil. We have, I have a lady, and she says that when she puts castor oil on her wrist, if she's in pain, man, it is amazing. She said, I don't know if it's in my mind or if it's real, but it's okay. But castor oil is amazing. Other things, of course, can be acupuncture. Acupuncture is great for relieving pain, both short and long term, depending on if you're covering all your bases. Are you addressing your hormones? Are you addressing your blood sugar? Are you addressing all of these things that have gone to create your digestion, to create this issue in the wrist? So, let's look at some of these products. Now, this is really going to be fun today. I have arranged these products based on, you know, a couple of things. Things that we have used, things that I've shown based on the risk factors. So, here are the male hormonal, right, balancers. Some, not all of them, some, that Vitamins Plus had in stock. Here are some female hormonal balancers that we actually use these quite a bit. Now, and then the thyroid response complete care. We've used that a lot, not necessarily to say here, this is for carpal tunnel, but here, this is for your underlying thyroidal issues, right? Tired, fatigue, things like that. Now, these things are in the actual naturopathic literature, right? B vitamins, specifically B6 and B12, but I find that most people need a B complex. And some people may need extra B6, extra B12, extra folate, but you know, we can talk about that with blood work and things like that. Also serapeptidase or other enzymes. Remember, if you have a problem in there, you need to break down that tissue, right? Decrease the inflammation, usually on an empty stomach. And magnesium. Remember, magnesium not only relaxes your mind, but can also relax your muscles and your tendons and all that. But our key product today, actually Dr. Kirby's pick, I feel like this is the climax of the story. It is hyaluronic acid, and it's like a plus thing. I've seen this relieve that pain a lot, quite a few times. Anyway, it is hyaluronic acid by now. It's not just hyaluronic acid. So everything's not the same as this particular one. And I'm sure there are others that work, but this is the one that Vitamins Plus has in stock. And this is, it has hyaluronic acid in it, as well as proline, alpha lipoic acid, and grapeseed extract. And I find that it can help with either getting that pain out or actually just giving you a little bit of relief, depending on how bad your condition is. Now, if you are working on carpal tunnel, especially if you have things like diabetes as your root cause, right? Diet or thyroid, what's your prognosis? How long should this take to clear up? Well, it could take, depending on the severity of your condition and how compliant you are, it could take anywhere from 6 months to a year. So it just depends on how long you've had it. It depends on what other conditions you have in your body, and you know how much you're willing to give. If you have, and thank you all for watching our video today. Please like us on YouTube, like us on Facebook, like us on Instagram, and hopefully we'll be getting a Twitter. I've been told I have to have Twitter, but that's okay. We'll be all good. But it's going to be great. We appreciate you all. If you have any questions, please give us a call or visit us online at www.wildflowerwellnessllc.com.